All right, so welcome to Cardiovascular Health. We're really excited to be offering this to you as a webinar this summer, and we want to really focus on our heart health all year long. So with that being said, we will get started. So cardiovascular health is one of the main pieces of health that we look at when we think about our overall health and well-being. And we know that we want our cardiovascular health to be as, ideal and optimal as we can. And so that can be really a lot to kind of take in, a lot to absorb. And we often think about just the heart and cardiovascular health, but there's also other components. And so we're really going to take time to break that down today and to focus the first half of our content on the relationship of cardiovascular health to your overall well-being, and then at the end give you kind of a toolkit where you can go and start making changes and improvements in your everyday health and well-being. So my name is Abby Horton. I'm a registered nurse. I'm a certified health and life coach. I'm a Wellbama ambassador and a wellness class educator for the University of Alabama. So I'm excited to be here. All right, so the class outcomes, we really want you to be able to identify healthy habits and to reduce your cardiovascular risk factors. We want you to be able to understand the relationship between cholesterol and hypertension and how that impacts your cardiovascular health. We want you to understand your risk factors for both having high cholesterol and hypertension. And we want you to be able to identify healthy habits that you can start to implement in your everyday life to start to take control over your health. So with your cardiovascular health, this refers to the health of the heart and the blood vessels. And so we know that there are several risk factors that can increase your risk for a cardiovascular health issue. And most of those you think of, maybe high blood pressure right off the bat, but also high cholesterol, tobacco use, and diabetes. And so we're going to talk about each of those and how they play a role in, making up your overall cardiovascular health. So with the American Heart Association, they have a campaign, and we all probably have heard of Go Red for Women, and usually that is in February, and they have their heart walk toward the end of February or beginning of March. But we really want to start emphasizing heart health and heart health awareness all year long because it's so crucial to how well we function day to day. But Go Red is actually an acronym, and many people may not know that it stands for Get Your Numbers. So we want you to know all of your, health and wellness markers. So what's your blood pressure? What's your heart rate? What's your, overall vital signs like your, pulse and respiration? We want you to know your BMI. We want you to know, all of those great numbers that you get at a Wellbama screening or at your annual checkup. We want you to know those numbers because that's going to be how you track the improvement and the progress you make. And we'll talk a little bit more about that in this presentation. We also want you to own your lifestyle. So we often talk about, how genetics play a role in our overall health, and genetics do play a role. But we also have this large part of, our overall risk factor that can be influenced by our lifestyle choices. So things like exercise, how much caffeine we consume, how much processed foods we eat, so many different things. Sleep, how well is your sleep? And so we want you to really own your lifestyle, and doing that means doing kind of an audit on where you are with your health and wellness and what your goals are. And then we want you to realize your risk factors. And so we all have individual risk factors depending on our lifestyle choices, our genetic backgrounds, different things that we might be susceptible to based on our own health histories, our family health histories. And so knowing your personal risk factors is really important. And then educating others. So once we know, it's really something that we want you to just share with your friends and your family and your community, because so many of us are at risk for heart health events. And so we also want you to not be silent. So if you have a problem, a risk factor, a health concern, or you feel like you need to reach out for help, we want you to have the tools and resources to be able to do that. So creating awareness is the first step. So thanks for joining in today. So cholesterol and hypertension, when we think about these two things, we often don't think about the relationship between cholesterol, hypertension, and cardiovascular health. And so we often hear, at least in the medical community, about hypertension being, a silent killer. And so the reason they call it the silent killer is because it's often thought that high blood pressure or hypertension doesn't have any really, prominent signs and symptoms or warning signs. And so while that is true overall, I think the real silent killer is cholesterol. And so when we think about having hypertension, as those, numbers worsen and as you start to feel sicker with your high blood pressure or your hypertension diagnosis, you will start to get symptoms. You will start to have fluid on board that starts to pull in your hands and your feet, or you'll have overall edema, so you'll feel really swollen or inflamed. You'll start to have headaches usually from those, blood pressure numbers going up. But with cholesterol, you really truly don't have any signs and symptoms of high cholesterol. And so it's important to understand that the reason that we have cholesterol on board in our bodies, the reason our body actually produces its own cholesterol is because we need it for healing. And so if you have an injury, a cut, or something that needs to be healed, cholesterol is part of that basis or that foundation for all of the hormones in the body to be able to then act and actually help you heal yourself. And so when you have a cut, an injury, or something like that, inflammation goes up, cholesterol goes up to support that healing process. And so when you have high cholesterol, oftentimes there are no other symptoms until you start to have hypertension. And so inflammation is present in the body if you have high cholesterol and hypertension, most likely. And it may be chronic inflammation. It might be, from autoimmune, it might be from diet and lifestyle choices, but inflammation is usually a problem for anyone who's having cardiovascular issues. And so I want you to think about inflammation really being the first sign that there might be an issue with your cardiovascular health. And then that inflammation starts a cascade between inflammation, cholesterol elevating, and then hypertension, so your blood pressure is elevating, and then you're having some heart issues. So on that chain of inflammation, cholesterol, and hypertension, we often don't start to see patients with presenting symptoms or having any sort of issues until they're at the hypertension stage, or sometimes even later in that stepped process where they're actually having a cardiovascular problem or a heart attack or an event, a blood clot or something. And so what I want to encourage you today is to think about how much inflammation you might be having in your body and in your lifestyle, because then we can really start to get at the root of the problem, which is that cholesterol and that inflammation that's then kind of driving the rest of the things that we see, which would be that high blood pressure and those cardiac issues. And so these two graphics really walk through that. We often think about cholesterol being the problem, but really what I like to tell people, especially when I'm teaching my students, is that when we have, a bad wreck, and you have a car crash and, someone calls 911 and an ambulance shows up, well, there's always an ambulance, at the site of those really severe wrecks. But the ambulance didn't cause the wreck. The ambulance is just there trying to help and assist in the healing process, right? And so that's the same thing with cholesterol. Cholesterol isn't causing the wreck. It isn't causing, necessarily, the underlying hypertension, high blood pressure issues, or cardiac issues, which is what the mainstream conversation is around cholesterol, that cholesterol is quote unquote bad. But really, cholesterol is just there and present because it has a role in the healing process. But because we see the cholesterol being elevated in these circumstances, we automatically think, oh, well, if you have high cholesterol, you're at high risk for heart attack, high blood pressure. And that is true, you are, but it's not because the cholesterol is high, it's because there's something else going on, and usually it's inflammation. So that's what these two graphics are really trying to get at, with kind of that relationship piece of how they go together. And so there's many things that we can do, and I think that's where we really want to focus our time, is what can we do to change these risk factors or improve our overall health. So when we think about cholesterol, we often think of bad. We think of that being the relationship. Cholesterol, you automatically think, oh, that's not good. But what cholesterol is it has three components. And so when we think about it, it's mainly comprised of fat and lipoproteins. And so the lipoprotein is actually consisting of cholesterol, protein, and a fat, which is usually a triglyceride. And so when you go and get your cholesterol numbers, you will see a breakdown sometimes where it has, triglycerides, and then it has HDL and LDL. And we often only talk about the total cholesterol, which doesn't really give us the context of what our numbers look like. And so when we think about, measuring cholesterol or having a conversation about cholesterol, we really want to think about what is our HDL, what is our LDL, and then what is our triglyceride number, because that's going to tell us more about our well-being and our health than the actual total cholesterol, which is what you're going to hear most often in a clinical setting. And so the reason I tell you all this is because HDL is considered to be the healthy or the good cholesterol, and LDL is considered to be the bad or unhealthy cholesterol. And when you add those two numbers up, with the triglycerides, there's a formula, and it outputs the total cholesterol number. Well, what you don't see and what you miss in the context of that total cholesterol number is your HDL. Your HDL might be really high, which is good. If it's over 60, that's great, particularly for our kind of diet and standard of living in the US. So your total cholesterol number could be too high, but it could actually be too high because your HDL is high, and that would not be a problem. That would actually be good. And so that's why it's so important to know your individual numbers. And I want to just point out that cholesterol is found naturally in the body and in the foods that we eat. And so, when we think about cholesterol, when we want to limit our cholesterol and get our numbers in check, we're really talking about not eating excess cholesterol in our diet and in our foods, because our body naturally produces cholesterol to help with the healing process, hormone production, vitamin D synthesis, and things like that. And so cholesterol is essential to the body. So that's why it's so important that we understand the relationship of cholesterol with cardiac issues, because we oftentimes just automatically think that all cholesterol is bad. And so, again, every cell in the body requires cholesterol. And so we want to make sure that we have a healthy relationship and really understand the purpose of what it does and how it helps us day to day. So when we think about cholesterol, it's really important that we know that cholesterol is very helpful in, the actual functioning of the body. And so when we take things to lower our cholesterol, in an unnatural way, so whether it's a medication, a supplement, or what have you, then that can sometimes have other impacts on the body. And it's not to say that you shouldn't take medicine. It's just to have that conversation with your healthcare provider. We're not offering medical advice about your particular medications today, but it is important to understand that you want to try diet and exercise, and you want to do lifestyle modifications as much as you can before you start to look at other ways to lower your cholesterol, because the cholesterol, when you start taking medications or supplements, may in fact lower all of your cholesterol. And so it can be difficult to heal then when you're, lowering your cholesterol and you're actually lowering your HDL. So cholesterol, again, is normal, and it's a healthy aspect of the body and your health. And your liver actually makes the cholesterol, but you can find cholesterol in foods such as meat and dairy products, particularly, when you're looking at processed foods, you can see that cholesterol and trans fats can be really damaging to your health when it's coming in the form of processed foods or, non-organic foods. And so you want to think about, really kind of cleaning up your diet, so to speak, so that you're getting the best quality foods that you can. And when you think about, having cholesterol being elevated and having that risk of pulmonary issues and coronary artery disease, you have to really think about, yes, that is an indication that you're at a greater risk, but you also have to think about, are there other things like, inflammation or diet that's playing a factor that we really can't kind of look at that relationship and understand. And so again, with the three types of cholesterol, the HDL, the LDL, or your triglycerides, you really want to think about knowing those individual numbers. The triglycerides really speak to how much fat is in your body and how much fat is in the cell. So any fat that isn't used often will get stored in the cells. And so we think about triglycerides really being mostly stored in like adipose tissue. And so when we have a lot of extra adipose tissue, or what's called fat tissue on the body, a lot of times it will be around our organs and our midsection. And so that's why it's so concerning when we have, extra weight on our stomachs or our bellies, because that extra, fat or adipose tissue is actually going to be, kind of interfering with the different organs and different things in our, in our core, which is different if we might carry our weight, on our legs or our lower half that doesn't have that same risk factor. So for people like me, I definitely carry my weight in my midsection. That's going to put me at a higher risk for, the kinds of things that we're talking about with heart attacks and cardiovascular issues. And so that is part of that equation, is really knowing how much fat you're getting in your diet and how much of that, fat is getting stored if you're not exercising regularly and you're not burning those calories off. And of course, fat has really been vilified since the 80s of, everything needs to be low fat. And, current research really talks to us about thinking of fat as being essential, because it is. Our brains need fat, our bodies need fat for a fuel source. And so, all fat is not bad. There are definitely, healthier versions of fat. And so, when you think about an avocado, some say that avocados are really healthy. Some say that avocados are not. Obviously, an avocado is going to be a healthier fat than, say, like a trans fat, which is not a true fat. It's a human-made chemical, or something like a meat protein or something that's going to give you fat. An avocado definitely would be a better source. And so it's important to think about food in relationship to how these numbers can change. And we'll dig a little deeper into that as we go. So the function of HDL and LDL, if you can think of Pac-Man, I don't know if anybody will get that reference. My students often don't. But if you think about Pac-Man and you think about, Pac-Man's job is to gobble up things, right? So the liver will actually send out the LDL when there, it needs to be some cholesterol that's carried to the cells. And so when there is extra cholesterol left over after the LDL kind of acts as that transporter to the cell, then the HDL gets released and it actually kind of gobbles up the extra cholesterol and takes it back to the liver. And so that's what you're seeing in this photo here. So you're seeing that, LDL kind of helps carry the cholesterol to the cells and transports it. And then when it's not being used up in those blood cells and in the vessels, the arteries, then the extra cholesterol is transported by HDL back to the liver. And so that's why it's so important that when you have, this extra LDL cholesterol that's left over, that's why the ratio of how much you have in LDL versus HDL is critical. Because if you have a lot of LDL cholesterol left over after it's been transported to the cell, but you have fewer HDL Pac-Man or workers to take the extra cholesterol back to the liver to be reused and kind of, starting that process over again, then the extra cholesterol is going to get stored in your arteries and it's going to form most likely some plaques. And so the plaque buildup actually, is what causes some of the cardiovascular issues that we have, because it can actually cause narrowing of the arteries, or it can cause, one of the plaques to erupt, which people now use kind of the symbolism of like a zit popping, which I know that's not the most pleasant example, but when a plaque releases and kind of, moves off of the artery wall, it's like a zit that pops, and that's what causes damage to those vessels in those arteries. So you want your HDL to be high so that you can actually have plenty of people, plenty of workers to take that extra cholesterol back to the liver. And it only becomes a problem when that ratio gets out of balance and you don't have enough HDL to get the cholesterol back where it needs to go. Then that's when the cholesterol gets stored where it doesn't need to be, and that leads to the health issues that we're talking about today. So with triglycerides, I told y'all that it's a type of fat that gets stored in the body, and it's the most common type. And so when you think about, foods, you think about butters and oils and other fats that we eat, we really have to think about the calories that we get from triglycerides. And so extra calories being on board, extra fat being on board that gets stored can be really problematic, as I mentioned. And so you really want to make sure that the calories that you eat are not getting, the kind of nutrient deprived calories that we sometimes can get out of vending machines or fast food. So we want to make sure that we're getting plant-based, whole foods that don't have a label, that were grown in a garden somewhere, because that's going to be the best source of calories and nutrients for your body, especially if you're trying to heal or repair anything, or you have a chronic health problem. You're really going to want to focus on your diet. And when your body needs energy, it's going to release the triglycerides. And so that's why it's so important to exercise, because when we're exercising, we're using up the things that are stored in our bodies. So we're using up and causing our body to kind of regenerate itself. And part of that is actually using up that extra fat or triglyceride that's stored. And that can be really helpful to your overall health. So when we think about types of fat, there's unsaturated fats, there's saturated fats, and then there's trans fats. And so with saturated fats, we'll talk about it first. Those are typically from animal fats, and it triggers our livers to make excess cholesterol. So if we can focus on getting unsaturated fats in our diets, that's what we really want to focus on, because again, our brain needs fat to operate, to function. Just for basic survival, we have to have that good fat. And if we don't, we're going to use it from our bodies. That's why, popular diets like the keto diet or low carb diets and things like that. That's why those are so popular, because it's putting your body in a state of depriving it from a nutrient so that it pulls that, from its, reserves basically. And so when we think about saturated fats, those can be problematic, because if we already have extra cholesterol on board and now we're triggering our liver to make more, our HDL is getting used up, and we're probably not eating the kinds of foods that are going to help support the production of more HDL. So we're making that deficit between HDL and LDL, that ratio, we're making it even bigger. And so it's kind of this vicious cycle. So with trans fats, then, those are man-made, or what I call human-made preservatives. So we call it a fat, it's trans fat, but it's really a chemical. And so this is also going to trigger your liver to make excess cholesterol. And so part of what I'm going to speak on a little bit later in the presentation is reading food labels. And most of us don't actually ever sit down and get taught how to read a food label or what those numbers mean. At most, we might look at the calories on the label, or we might look at, maybe if it has a certain vitamin, maybe we look at that. But mostly we're kind of taught and conditioned to just look at the calories, and if the calories look okay, then we're good to go. We might look at the fat too, because, a lot of us are really weary of having fat in our diets that we're not sure about. And so we just get overburdened with that. And we're like, we're just going to do low fat everything. And when we have low fat, products, and it says that this is low fat yogurt, low fat milk, those things typically have more sugar in them, because when you take the fat out of them, they're pretty bland, and some things are really tasteless. When you take out some of the trans fats and some of the other preservatives, the food actually doesn't look that appetizing. And so the preservatives and extra additives that are put into our foods are there for shelf stabilization, for it to look appetizing, for it to be appetizing to eat. And so when we take those things out, then we have to put things back to make it edible. So there's going to be more sugar in things like low fat yogurts or low fat dairy or whatever packaging you have that's low fat. There's going to be more chemicals and preservatives and additives in those products too. And so, again, you have to do what's best for you. Consult your healthcare provider, consult a nutritionist for your own personal needs. But for me personally, I would rather have, in moderation, the real fat product, so whole milk, or full fat yogurt. I would rather have the whole product with the full fat and consume less of it than to have the low fat where I'm having those extra chemicals and preservatives and things on board. So that's just a personal choice, and it's something for you to think about. So you want to try to get trans fats to where it's 0 on the list, and then you want to try to have more unsaturated fats. Unsaturated fats don't sound like that's the right choice, but that's the one that you really want to focus on when you're trying to consume that good fat in your diet. And then with triglyceride normal value ranges, I've listed these here for you from the American Heart Association. And so this is just a graphic for you to refer to when you think about what you want your numbers to be. And so we typically want to see that your triglyceride level is below 150. And so that's a good way for when you look at your total cholesterol and you look at the breakdown, you know that 150 or less is kind of your benchmark for being in the green zone, or the kind of thumbs up, you're doing good with your triglycerides, if you're in that zone 150 or less. And then, you can have, 150 and higher. So you can have borderline high, high, and very high. Once you start to get to borderline high and high, people will start recommending in the healthcare community that you start to seek out medications and lifestyle modifications and things of that nature. And so they don't let triglycerides, cholesterol, blood pressure get too elevated, before they start wanting to have some sort of intervention, whether it's a medication or a lifestyle, intervention, because it is difficult to, start to control that once you get the numbers increasing. So they just don't want that to get out of control. So they start to do a lot of early intervention, which is good. You want to catch things as early as you can. So cholesterol is just a soft, waxy substance. And so if you've ever thought about, we think about, gallbladder surgery. I don't know. I do as a nurse. When we have gallstones and we think, that those are actual stones, we think about rocks like a kidney stone. But a lot of times gallstones are just cholesterol deposits that have blocked your gallbladder or your common bile duct. And so, we think that the cholesterol is going to be something that's hard, or that is small, because we think of kidney stones, but cholesterol usually is actually pretty big. It's usually about the size of a kernel of corn, or or more kernel of corn. And so cholesterol is kind of that look and shape and that color, and it's very waxy and it's very spongy, almost like a spongy Play-Doh. And so when that gets to be in our arteries and like stored in places in the body that it doesn't belong because it can't get back to the liver, it's very sticky and gummy. And so that's what causes the problem in our vessels, because it's difficult to get out of there because it does want to stick to everything. And so that's important to know about cholesterol, because it can't just be flushed out like a kidney stone would be. So giving y'all that visual, I've actually felt a cholesterol deposit or a gallstone and was really shocked to see that it was just really kind of squishy and sticky and not an actual hard substance like a kidney stone. And so when you think about this cholesterol circulating through your bloodstream, that's why water and being hydrated is so important, because you want to continue making sure that your body is circulating and recycling all of the things in your body that needs to be expelled or needs to be absorbed somewhere else, in the body by your cells. And so having water on board and staying hydrated is super important to your overall health. And that's one reason. And so you also want to make sure that when you're having your screenings every year, that you're getting screened for heart disease risk factors. And if you have a history of heart issues, or you have a history of high blood pressure, high cholesterol, or autoimmune inflammation, chronic diseases, those are going to be things that you want to mention to your healthcare provider so that they can do extra screenings or take extra steps to make sure that your numbers look good and that you're not having any signs or symptoms. You just want to make sure that you're aware of those things. For me, I have a heart screening, although I'm just in my mid-30s, because I have a strong family history of heart disease on both sides of my family, and both of my parents and grandparents, have had heart issues. And so it's important that I know, what my risk factors are, and that I get screened earlier and more often than maybe my counterparts. So you want to make sure that your healthcare provider knows those specific things about you. These are the kind of formulas here in the center, talking about total cholesterol, bad cholesterol, good cholesterol, and triglycerides, and then dividing by 5. That's the formula that's used to look at your risk factor. And the basic thing that you want to know is really just the individual numbers matter more than the total cholesterol does in terms of context, and understanding that you want your HDL to be at 60 or higher if you can get it to that number, so that you have a good healthy ratio of helpers on board to get that cholesterol back to the liver. So the downside of cholesterol, again, is that it can accumulate in the arteries and impact our heart health, and it can cause the arteries to narrow or become less flexible. And so we see here with the arrows at the screen, having this high cholesterol that then starts to impact the arteries with atherosclerosis that can then lead to heart disease or heart attack and stroke. And so, while that it is a progression for some, we know that we can impact our heart health, and we know that we can impact our ability to eat well and to exercise and to support our body to heal itself. Our bodies are designed to heal themselves. And so that's what's so encouraging about talking about a topic this serious, is that there are steps that we can take starting today, as soon as you get off this call, that can drastically improve your outlook and your overall health. And so again, it's important to know that there aren't any symptoms of high cholesterol. And so if you're, having any sort of issues or risk factors, you may just ask that your cholesterol be checked. And certainly that's something that we do at the BAMA screenings typically, to be able to give you that good information and be able to really monitor your health. So some things, again, we mentioned heart attack and stroke and poor circulation, blood clots would go along with that, high blood pressure. So those are some health concerns with our cardiovascular health. But what we're really wanting to focus on is understanding the relationship between all of these factors, and then really starting to prevent any of these things from happening, or lessening, the impact if you were to have a cardiovascular issue. So this is just a progression of what it can look like when you have what's considered to be a normal artery that's open, and blood is flowing freely through, and then the beginning accumulation of cholesterol plaques, then all the way over to a complete blockage. And you'll see that at the complete blockage, the reason I think it's so important to show this is that we say a complete blockage in the medical community, but usually a complete blockage is 70 to 80% or more of a blockage. So it's not actually 100%, which is what you would think. But even something like being occluded or having that blocked off 70% or more would be, considered a complete blockage, because it's really impacting your blood flow and your oxygenation and things like that. So it's important to kind of, visualize that, I think, and talk about some of the nuances of that. Even though we don't want to get too medical in this presentation, I think when you understand the why behind the why, when you understand the rationale of why water is important. We talk about drink more water, be hydrated, but then we don't always connect back to it's because we have a sticky substance in our body, and we just want to make sure that we have enough water on board that the sticky stuff isn't sticking to our insides. That is so simplistic. And that's not how we would ever teach that, in a nursing school setting. But when we think about it, that makes me more motivated to drink water versus just being told, hey, you should really drink 64 ounces of water, or you should really drink half your body weight in ounces of water. When I'm thinking practically about, I want to keep sticky stuff from sticking to my insides. I need to go drink some more water. That to me is much more motivating than just checking it off my list for the day. So maybe that will help you as well. So when we think about that inflammation that kind of triggered this whole cascade of symptoms, we can see is that, our high levels of cholesterol, are really occurring in the bloodstream. And so it walks you through how this inflammation triggers a response, and it actually starts to speed up the accumulation of cholesterol, because the cholesterol is trying to be that ambulance. It's trying to rush to the scene and help, but then it kind of collides with that inflammation response, and then we've got this buildup of cholesterol. And so that's why inflammation can be a trigger, and that's why inflammation can be difficult to actually manage. So here are some warning signs I always like to include when we're talking about something as serious as cardiovascular health. Some signs and symptoms to look out for when we think of stroke or heart attack. We often think about, with stroke, we think about some memory issues, or collapsing. With heart attack, we think about someone grabbing their left arm and shoulder and having that radiating pain. But really, there are more subtle signs of heart attack before. Something as simple as having a low O2 sat, so a low oxygen saturation. My mom had a heart attack in 2006, and she was a healthy nurse. She was up doing activities of daily living and enjoying her life on a Sunday evening, and had a heart attack and had to be rushed to the emergency room for open heart surgery. And the only symptom that she had as a female, we present differently usually with these types of events. She didn't have that left, radiating pain. She only had low O2 sats, or oxygen saturation readings, when she went for her annual checkup. That was the only thing that was not within normal limits. And so it was already showing some signs that she wasn't getting the good oxygen and blood flow that she needed. And that was her only symptom until she started having some pain in her abdomen, of all places. And it was so severe that she was very sick, and her best friend took her to the emergency room. And she's a nurse, and she didn't think she was having a heart attack because she was conditioned to think about that left-sided pain. And so there are some other things here that really speak to, painful, numb, or cold hands and feet. We don't think about that with a cardiovascular issue, not in our communities. Erectile dysfunction, that can be something that we don't think about. Low back pain. We do typically think about, fatigue. We typically think about shortness of breath and chest pain, but just know that there are more subtle signs. And if something doesn't feel right, then you always should just reach out for help. And your body the best, and I think that's what's so important, is to constantly remind people that you are the expert on your body and how you feel. And so definitely advocate for yourself, and when you know that something doesn't feel right, then seek the help that you need. And that is the biggest piece of teaching advice that I can give, is that we want you to feel a part of the team when you're thinking about taking care of your health. You're in the driver's seat of that health and wellness journey. So blood pressure then goes up because that cholesterol is in our arteries. And so, we've got that blood pressure that is trying to get blood somewhere, to or from the heart. And so we've got the vessels that pump the blood, and now we have these builds up of, or these plaques of cholesterol, and the blood can't get through. So it's like kinking off, or cutting off a water hose, where if it's got like a little loop in it and you can't get the water past, then the pressure builds up, right? And sometimes the water hose will bust, or it will have a split in it, or something happens to it, right? And when you release it, then that pressure, usually that water pressure, will go down, because then it's not having to work so hard to get past that place in the hose. It's the same thing with our vessels. And so we just want to make sure that, when we see that this blood pressure is elevated, that might be the first time that we know that something is, kind of awry, or that we need to check on something related to our cholesterol and our inflammation. And so that's when the blood pressure goes up. So that's the relationship to the cholesterol and the inflammation. And this is just another example, again, of how you can see the hypertension developing as it starts to narrow. And so you can have high blood pressure readings without having a hypertension diagnosis. I use the example, with my students or patients is that, if you have a stressful test or a stressful event coming up, you might have a high blood pressure reading, but that doesn't mean that you have hypertension. But usually after having 3 high blood pressure readings, you will typically be diagnosed with hypertension. And so it's important to know if you're not going to the doctor very often, that's why we have you come back in to have a check on those blood pressures, because we don't want you going a year or a year and a half or 2 years, depending on how often you see your doctor or healthcare provider, to get that hypertension diagnosis, because we want you to get whatever medications and lifestyle modifications on board sooner than that. So again, this is another example of how that, plaque builds up. And all of this is not so that you have, a medical knowledge of blood pressure or cardiovascular issues. But I think when we understand, again, why these things are happening, I think it's so important for us to be able to have the motivation and the knowledge then to go and make changes. And that's going to help you actually make changes that we may not see. We may not know a risk factor that you have, but now that you're equipped to understand how all of this works together, you can start noticing patterns and start picking up on, my body doesn't respond well when I eat this food, or, when I have that exercise program, that I'm doing and I don't feel good the next day, I have some, extra fluid on board. You can start to recognize your own patterns when you are equipped with this kind of knowledge. So this is the chart, and again, you want to be in the green zone, less than 120 over 80 for your blood pressure. So these are the new guidelines that came out almost 2 years ago, where we really are wanting your blood pressure to be a little bit lower than what we originally, were working off of. So 120 over 80 used to be, that was great. Even a few points above was fine, but now we really want you to be less than that. And once you start to get, closer to 130, and closer to 90, you're going to start hearing things about lifestyle modifications and diet and exercise and things like that, because we don't want you to get into those elevated or high risk stages of high blood pressure. So some recommendations, again, having healthy, lifestyle choices, doing regular checkups and things is really important. Knowing your numbers and tracking those numbers is really important, because what might be a healthy choice for me might not be a healthy choice for you. We're all really individual. And so that's why it's important that you really track your responses to food and exercise and sleep and find out what works best for you. So this is just another graphic that goes through the blood pressures, just to give you kind of a benchmark of what you're looking for. And then these are some hypertension symptoms. And so while we talk about it being the silent killer, there really are a lot of signs and symptoms that are associated with high blood pressure, and prolonged high blood pressure being hypertension. So headache, shortness of breath, nosebleeds that occur pretty frequently, feeling flushed or dizzy, having some chest pain, having an irregular heartbeat. When you have that pounding sensation in your chest, neck, or ears. I've had high blood pressure before where I felt really flushed, like I felt stressed, and then I had this pounding sensation. And it's just because that pressure is just really, really doing a lot to try to get to where it needs to go, and it's causing that sensation. You definitely can have visual changes, and so you might have a perfect eye exam, but you might have blurry vision, or you might not have the same visual acuity that you once had, but your provider's telling you that they don't see anything with your vision. It may be a blood pressure change. And then more severely, you can definitely have blood or in your urine, or fatigue, or even confusion if it gets to be too high, especially in those hypertensive states. And I mentioned this, but our blood pressure fluctuates. So they do like to have 3 or more readings before you have a diagnosis of hypertension. But our blood pressure fluctuates throughout the day. And that's, really typical, because it fluctuates along with what we're doing, our activities, with our hormone sensations and things like that. So, it's going to be really typical that you're going to have different readings. You can even have different blood pressure readings, in one arm versus the other. And that's not uncommon at all. all. And so it's important that if you do have high blood pressure issues, that you're checking it regularly and that you're writing down what you're doing when you check your blood pressure and what time of day, because that will really help look for patterns. If, maybe you're just having high blood pressure when you go to the doctor, or maybe you're just having high blood pressure when you have a stressful, meeting coming up, or, maybe you have to give a presentation, something like that. There may be a pattern, and your blood pressure may be okay other times, or it may not be, but it will be really helpful to know those particular things about your pressure readings. And then health effects on high blood pressure. So again, you probably know most of these, but I think it's important to point out, and these overlap with your cardiovascular risk factors. You also can have high blood sugar along with this. And so when we do see that the inflammation and the cholesterol start to rise, then you're going to start to see effects on your blood sugar, because your body needs the extra blood sugar for energy, and that's the quickest way to get energy to the body is by releasing some of that that blood glucose, so that you can heal and repair and have energy. And so it's not uncommon to have high blood pressure with this as well. So the impact of hypertension, we have about 75 million Americans who have high blood pressure. So that's about 1 in 3 adults who may have prehypertension or hypertension. And about only half of those people with the diagnosis or suspected diagnosis are actually well controlled. And it can be pretty challenging to control your blood pressure because there are so many things that causes it to fluctuate. Stress, how much sleep you got the night before, how hydrated you are, what you've been eating. And so just taking a pill in the morning to control your blood pressure can be really difficult to have it well controlled every day, all day, given how many factors influence it. So these are some other risk factors for your overall cardiovascular, health. And, of course, stress and smoking are really, key ones there. Any type of, substance use can impact it. Obesity, for the reasons we mentioned before, diabetes, our salt intake, specifically sodium, like table salt. We're not talking about, Celtic sea salt or, pink Himalayan salt. Those are usually okay and have trace, minerals and electrolytes that are really helpful. We're talking about the white table salt that that has really been, added to and change the composition of it. Overly processed diets and caffeine consumption can play a role. And of course, you have, things that are a little more difficult for you to control, like your family history and your genetic risk factors, your ethnicity, your age, and your gender or your sex. And so that can be really, some important things to note, because depending on, what region of the world you originate from, whether or not you have a family history, all of those things can increase your risk for cardiovascular issues. So you can have treatments and medications and things, and I'm not going to talk to you about those as much, but just know that these are some common treatments, just over-the-counter medications that you can get. And then, of course, diabetes playing a role in this relationship, because, again, that glucose is going to help with the damage to the lining of the blood vessels. And so it's going to try to, get on board to help that healing process. And then in turn, it's going to actually continue to rise because the healing never actually occurs. And so you can have things like high cholesterol and diabetes, and all of these risk factors can combine together to what's called metabolic syndrome, which will put you at a higher risk for continued cardiovascular issues. So now I want to switch over to the holistic approach to health and how you can actually start taking steps as soon as you get off the call today to really own your health and start to make small changes that really will add up. And so here are 7 steps to a healthier heart. And it talks about, reducing or quitting your smoking and tobacco use, monitoring your blood pressure, maintaining a healthy weight, which is typically going to be less than 25 on the BMI scale for most people. watching your cholesterol. You're wanting, your total cholesterol to be over or to be under 200, but you're remembering that those individual components are actually more important when you're thinking about the context of your overall health. You want your blood sugar to be, less than 100, 99, 100, to be, your fasting blood glucose in the mornings. And you want to make sure that you're getting active, that you're working out or being really mindful about exercise 4 to 5 times a week, usually about 30 minutes a day, 4 to 5 times a week is what the base, recommendation is for getting active and moving. And I always think that walking is the best way if you haven't started exercising. And then eating a healthy, diet, and that can be a heart healthy diet. But really, a heart healthy diet is a healthy diet for everyone, because it's really just eating more fruits and vegetables and whole grains and having fish weekly, which a lot of us don't do. And then making sure that we're limiting that sodium or salt intake, the saturated fats that we talked about, and any added sugars or processed foods that we kind of mentioned earlier on. So when I talk to people about, really getting healthy and striving for a healthier lifestyle, I talk to them about 5 to Thrive, because I think this is where it starts. And so that's why I dropped the start here pin, because regardless of whether you're having difficulty, with your sleep or your blood pressure or your blood sugar or high cholesterol or, diabetes, heart issues, autoimmune issues, any type of chronic illness, these are the 5 basic things that you can do to start making progress toward healing your body and toward, achieving a different level of health. And so making sure that you're sleeping well at night. We talk about the quantity of hours that we sleep, but if you can aim for 7 to 8, that's great. But we also want to think about 7 to 8 quality hours of sleep. So you might go to sleep and, you might go to sleep at midnight and sleep in until you get 7 or 8 hours of sleep, but that's not quality, ideal, or optimal sleep. You want to be in, a place where it's cool and it's dark and you're in bed by 10 and you're getting uninterrupted sleep and you're really, actually getting restorative sleep. That's what's important. It's not just the number of hours. You want to make sure that you're staying hydrated. And we typically tell people, instead of the 8 ounce glasses of water a day, we typically say about half your body weight in ounces daily. If you're over 200 pounds or more, you may not be able to drink half your body weight in ounces a day, and that's okay. You definitely don't want to overhydrate, because that can be dangerous. But you might need more than 64 ounces of water a day. I need more than 64 ounces of water to feel well hydrated. And so that's another part of tracking your progress, is seeing, where do you feel good and healthy with your water consumption? Is it more than 64 ounces? Is it less than 100? How do you feel day to day? That can be really helpful for you deciding how much you need to drink. And it'll vary. So if I'm teaching all day, I'm going to need to drink more water versus a day where I'm having office hours and I'm not really talking that much, because the more you talk, the more you are getting dehydrated. The more you exercise, the more dehydrated you're getting, so you would need to drink more on those days. You want to strive for a healthy plate, so you want to have half of your plate be vegetables, and you want to eat the rainbow. We typically only think about green foods as being healthy, but we really want to have, red foods and purple foods and yellow foods and green foods. And so if your plate is beige and, doesn't have any, bright, vibrant colors to it, then you probably need to add some more color there. You want to move your body every day, and that may not be, a high intensity interval training, which is really great for cardio and for, heart health, but maybe you start out with walking, or maybe you swim, or maybe you dance in your kitchen before you're cooking your healthy meal, but making sure that you're moving your body and hopefully working up to that 30 minutes a day. And then to take care of your mind and help to eliminate some of the stress and stressors that kind of weigh on us sometimes, we can really recommend meditation. So meditating for 3 to 5 minutes a day can be really helpful. This can look like you just sitting in silence on your back porch before your day gets started, This could be you doing yoga for a few minutes, maybe do a few yoga poses. This could be you sitting in a chair or sitting in your car before you go somewhere in the morning. It's just letting your brain reset for the day. And so it doesn't have to look like, you sitting on the floor, for an extended period of time and trying to obtain, no thoughts. Meditation is really about recognizing the thoughts that pop up into our minds and acknowledging them and letting them go. And when I realized that meditation could look different for me, and it could look like me listening to music for 5 minutes, and it didn't mean that I was trying to get rid of my thoughts, then I really embraced meditation for what it is. And it's very, very helpful to your overall health. So with sleep, here are some tips. I've tried to include 5 tips to help with each of these. So we can make this available to you. With sleep, again, the 7 to 8 hours nightly, the being in bed by 10, because that works with your natural circadian rhythms and how your body heals and restores itself. We're designed to heal and restore between 10 and 10 and midnight. And we want to make sure that we're having a good evening routine and that we don't have a lot of electronic devices in our rooms or a lot of use after 9. Keep your room cool and dark. That's all going to help promote healthy sleep. And certainly there are more things, but pick one thing and then really kind of dive deep into that. I think sleep and hydration are your 2 that I would start with, that I personally started with on my health journey. Set your hydration goal. Track your progress. Make sure you're drinking your water and tracking how much you're drinking and tracking how you feel when you drink that much water. Carry your water bottle with you. It's easy when we're working from home because it's easily available. When we go back to campus, make sure you have a water bottle with you, and then make it fun to drink water. Whether you're using sparkling water or you're adding, mint and, lemon or lime to it, you can make it fun if you don't like plain water. And then nourish. So you want to really eat for health and not eat for weight loss. And when we talk about healthy foods and healthy living, we often think about eating for weight loss. For here, we're really focusing on eating for health. So a balanced meal, you want to try to include a protein, a complex carbohydrate, and a healthy fat at every meal. And that's going to really help sustain you and keep your blood sugars level. So that's really important when we're thinking about cardiovascular health. So aim for that colorful plate and eat that rainbow. Track your meals and your snacks. This could be with an app like MyFitnessPal or with a food journal. And then try to make one healthy change at a time. So maybe if soft drinks are really hard for you, that you like to get a soft drink every day, you might start with that and might start not, having one with dinner, and then maybe you don't have one with lunch, and start making, small incremental changes to your diet in that way. When you focus on adding things in, that's really helpful too. So adding things like a smoothie, or adding things like healthy treats. When you add things to your diet to be healthy, that's always more effective than taking things away. So start with adding in the good stuff, and eventually it's going to crowd out the not so good stuff. And then the DASH diet is usually what's clinically recommended for a healthy meal for people who struggle with hypertension or cardiovascular issues. And I think these are good recommendations. There's lots of information online about this. Again, the only thing that I would caution about is the fat-free or the low-fat food choices that they promote, for all of the reasons that we mentioned earlier. But otherwise, the DASH diet can really be helpful in you achieving your goals. But other than that, I think just focusing on, plant-based whole foods will be really helpful for you. And then here's the food label. Again, I just wanted to point out where it has the total fat, the saturated fat, and the trans fat. That's how you can add up the saturated and the trans and subtract from the total fat to know, what your unsaturated fats are. It doesn't actually list unsaturated fats there. And then, looking at your calorie count, looking at added cholesterol, which on here there isn't any extra added cholesterol. looking at your sodium. So all of those things are important to really look at when you're reading a food label and you're making choices about the different products or things that you're using. The best option is to not, choose foods with a food label, but we all are going to have those moments where we buy something that's prepackaged, and this will help you make a healthier choice. And here's some more information here that gives you a little bit more of a step-by-step of how to understand a food label. And it walks you through the different numbers, and it's color-coded. And I think this is just a great resource. This is all a toolkit that you can kind of use and explore on your own. But I think it's important to give you a starting place when you start to make these healthy choices. And then these are some things that you can try: turmeric, omega-3s, fiber, more plant-based options, healthy fats. Try those things, adding those into your diet first, and then try limiting your sugar and refined carbs and limiting your alcohol consumption, maybe going meatless once a week. Maybe you have meatless Monday, and then again, avoiding those trans fats and those processed foods. And then we want to make sure that we're moving, and things like yoga, Pilates, walking, swimming, Tai Chi, those are all great low impact ways to start exercising every day if that's not something that you're accustomed to doing. And then again, when we think about adding an exercising 3 to 5 times a week is a good place to start, and maintaining a sustained heart rate. So you want to see that your heart rate is up a little bit and that you're actually sweating, because if your heart rate's not elevated and you're not sweating, you're probably not getting that good cardiovascular benefit. And HIIT workouts are ideal once you have built your way up to those workouts, because it's called high intensity interval training, and it's like circuit training where you're going from one activity to another pretty quickly and you're keeping that sustained heart rate. But it is something that you have to work up to. But those are some of the best workouts you can do. It's a type of exercise and workout. It's not like a brand or a gym, but it's just a type of workout, like cardio is a type of workout. And there's tons of free HIIT workouts online once you get to that point. But I would recommend maybe signing up for a personal trainer to start with the basics once you get walking underway if you're starting a new exercise program. We're going to be wrapping up soon, but I just want to walk you through a few more things. Again, we talked about body mass index, and just in general, a 10% weight loss. Losing 10% of your total body weight can be dramatic in terms of changing your health and changing the numbers that we're tracking. So it doesn't take dramatic weight loss to see a dramatic improvement in your health. And this is another way of looking at it. I think this is a great way to visualize when you're in the normal or overweight ranges. And again, the BMI is just a tool. So, people who are athletic, or who have more muscle on board, or, there's multiple reasons why the BMI could be, saying that you're overweight or obese, and maybe your numbers are fine. Maybe you don't have the same risk factors. So just remember to use the BMI as a tool, and let it help you track your weight loss and your goals. And then stress, we know stress can affect the body, and it affects every part of our bodies, not just our minds, but also, our body systems. And so it's important that we get that stress under control as much as we can. There's a TED Talk called How to Make Stress Your Friend by Kelly McGonigal, and that would be a really great TED Talk to watch if you want to look more into stress reduction. But things like meditation, sleeping well, staying hydrated, eating well, really taking care of your body, those are the basics, those 5 to thrive. That's going to really help take care and take the strain off of your body that this stress is producing. So I would start there. And then meditation, you can do things like yoga nidra, which is a yoga practice for the mind. Meditation apps, there's lots of free ones out there. Relaxing music, quiet time, or just looking at some affirmations online. And then I think it's so important to remember to laugh every day. If you're a really serious person, I'm a really serious person. So sometimes, laughing in the moment is not my go-to. It's not the thing I naturally do. I have to really remind myself to do it. So for you who are really fun, laughing every day may not be on your to-do list because you just naturally do it, but I have to remind myself, and I think that's a really good thing to do to really relieve your stress and to refocus, because life is serious, but it doesn't have to be serious all the day. And then, of course, smoking, vaping, tobacco use, you want to make sure that you limit or reduce those things, because those are going to have, effect on your oxygenation and your arteries. And ultimately, it's going to result in poor health outcomes. And there's lots of resources that can help with smoking cessation or substance abuse if you need that help. We have great resources at UA, so I would highly encourage those. The focus on June is gratitude. So I know we're about halfway through the month, which is hard to believe, but if you want to get more information about the gratitude practice and free calendar, you can hop over to the wellness site and get that. And that's something that I've done this month, and I've really enjoyed it. Carolyn McVicker is on the call, and she put that information and resources together. And it's a great way to really refocus and take some time away from all of this stress and remember the things to be grateful for. Some upcoming June classes. So this Friday on June 19th, Dr. Josh Iyer with his guest, Dr. Robert Laird, is going to be talking about how to be a consistent parent. And so I think this is going to be a great, talk for, anyone who's struggling maybe during the pandemic with, extra needs and things that, children may be struggling with, maybe you're struggling with. They sometimes mirror the stress that they see. And so I think this is going to be a really great resource for parents. And I know that if I can't tune in, I'm going to definitely go back and watch the replay, because I know it's going to be a great time with Dr. Iyer and his guest, Dr. Laird. And then I will be doing the last talk of June on the 24th, the alleviating everyday aches and pains. And so feel free to join in there or share with your friends. And then we'll have some classes coming up for y'all in July as well. And I know we've got some questions. I just want to tell you how you can follow us. And the latest thing we've added is the blog. So every class that I teach will have an associated blog with it. So would love for you to go check out that and some extra resources there. And then if you're interested in health and life coaching, you can reach out to me and I'd be happy to offer those services for you. So I'm going to check the questions. Can you have inflammation without swelling? Yes, you can. So you can have what's called systemic swelling or inflammation in the body, where, it's something that's been going on for a long time. And so, eventually you will see the outer effects of the inflammation, because you're going to have extra, water or fluid on board. We say water, but we really mean fluid. So you will eventually see the effects of inflammation on the outside, but it's not going to be as noticeable as if you walked across the parking lot today and sprained your ankle and you see that immediate, swelling that's just so noticeable and so painful. It's not going to be that noticeable because it comes on over time, but eventually you'll get to the point where you do have so much swelling that you do start to see puffiness in your face and in your belly and your hands and in your feet. And that's probably when it's gotten to the point that your blood pressure is high. And so your kidneys are kind of working overtime to get all of the blood and fluid where it needs to be. And so it's not able to really deal with the extra fluid in your body because it's dealing with the blood. And so that's kind of where you see that inflammation kind of starting to come to the surface, so to speak. And so if that is a concern for you, definitely reach out to your healthcare provider and they can walk you through. And hormones can cause you to have inflammation and for you to have changes in your fluids in your body. So this is going to be something that definitely fluctuates and changes, particularly for women. So so some fluctuations in that is something that you would expect. Let me know if that didn't answer your question. And I'm going to go over to the chat and see if we've got anything there. All right. Great. Awesome. Okay, are there any other questions? I know we went over time, but I get really passionate about cardiovascular health. It's really important to me personally and professionally, and I could talk about it for more time than we have. But my heart is to, equip you with the understanding so that you can then go and make some great changes in your life and just take one thing at a time. You can get really overwhelmed with making lots of changes and then you quit in a few days because you didn't see progress. but really just, you know, if sleep is where your pain point is, then work on your sleep this week. When you don't have to think about your sleep habits, you know, the things that I shared, then work on hydration, or, you know, work on hydration and then sleep. Wherever your pain point is, work on those things first and then add in the next layer. And that's how health, you know, really builds. And that's how you get a lot of success with, you know, the things that you're doing. Otherwise, if you try to do everything at one time, you're going to get overwhelmed and you're going to want to quit because it doesn't feel doable. So long-lasting, sustainable change really is just one baby step at a time and celebrating your little wins along the way. Any other questions that I can answer for y'all? I'll wait just a minute to see if we have any. All right. Well, I hope you have a wonderful rest of your day. Y'all get a good night's sleep tonight, and y'all go refill your water bottle. Okay. Thank y'all so much. Have a great rest of your day.